Hello, my name is Pejman Ganouni, and I'm a radiologist here at Stanford and a member of the Body MRI section. During this presentation, we'll discuss MR-guided focus ultrasound treatment of uterine fibroids, including our experience here, the details of the procedure, and what outcomes you can expect. First, a little about uterine fibroids, which are very common. Up to 40% of women have uterine fibroids, and about 25% of women suffer from symptoms related to their uterine fibroids. Symptoms can include heavy menstrual bleeding, as well as bulk symptoms such as urinary frequency, pelvic pain, and dyspareunia. MR-guided focus ultrasound using the Insightec Exablate system was approved by the FDA nearly a decade ago and has been used worldwide to treat between 10,000 to 15,000 women. Options for treatment include hormonal therapy, which are used to regulate menses and typically provide temporary relief. Definitive management can be achieved through hysterectomy, which has the advantages of removing the uterus and thereby preventing any further symptoms from fibroids. For women who wish to preserve their uterus, however, less invasive procedures are appropriate to consider. These include surgical procedures such as myomectomy, in which only a portion of the uterus is removed, or interventional procedures such as uterine fibroid embolization or MR-guided focus ultrasound. Compared to surgical interventions such as hysterectomy or myomectomy, or compared to uterine fibroid embolization, which are generally appropriate treatment options for most women with symptomatic uterine fibroids, the key to successful treatment of uterine fibroids with MR-guided focus ultrasound is careful patient selection. The criteria for treatment depend on the appearance of the uterus and fibroids on an MRI of the pelvis. An appropriate candidate for MR-guided focus ultrasound treatment has a uterus that is not too large and is below the level of the umbilicus. The fibroids must be evaluated in terms of their number, size, and location, as well as their signal intensity and appearance on MRI. There cannot be any scars or bowel or any metal in the beam path. And of course, we must ascertain that the fibroids that we see on MR are actually responsible for the patient's symptoms. MR-guided focus ultrasound is a non-invasive procedure. Treatment is performed under MR imaging guidance to allow visualization of the uterus and the fibroid to see as the treatment is being performed that the fibroid is being heated sufficiently to result in destruction of the targeted fibroid tissue. We've been performing MR-guided focus ultrasound treatments here at Stanford for over the past 3 years and are one of the leaders in the development and application of this technology. On the treatment day, a nurse prepares you for the procedure. An IV line is placed so that medications can be administered for sedation. The treatment area is shaved, covering from the umbilicus to just below the pubic symphysis. A Foley catheter is placed in the bladder to drain it during the treatment. Ultrasound gel is placed in the rectum, both to displace gas in the bowel, as well as to increase the safety margin between the uterus and the sacrum, which is located posterior to the uterus. You will lie on your stomach on the focus ultrasound table on top of a gel pad with your lower abdomen in a water bath. This allows coupling between the skin and the focus ultrasound device, which is built into the table. Your feet will be facing the MR magnet, with your head and shoulders near the opening of the magnet. You'll be awake throughout the entire treatment, which takes place in the MR magnet, and you'll be able to communicate with me through an intercom. I'll be able to observe you through a glass window that separates the MR room from the control room, and a nurse will be checking on you periodically. Before the treatment begins, MR pictures are taken and used to plan the treatment. These MR images show a uterine fibroid being targeted for treatment. Individual sonications are shown as the green rectangles. Planning includes multiple steps designed for safety, including delineating the anterior abdominal skin line, as well as the location of the pubic bone and the sacral nerve roots. In particular, the relationship of the uterus to surrounding bowel is assessed, and the treatment is planned so that no ultrasound energy passes through the bowel on the way to the uterus. Individual ultrasound heating steps, called sonications, are initiated with low subtherapeutic doses used to adjust the targeting of the beam, followed by increasing energies designed to achieve adequate heating of the fibroid such that the targeted tissue is destroyed. Multiple such sonications are performed until the entirety of the targeted fibroid is treated. Each sonication lasts about 20 seconds, followed by a brief period designed to allow the intervening tissue in the beam path to cool, followed by another sonication. While the focus ultrasound energy is being delivered, you may feel a warming sensation in your pelvis or a cramp similar to a menstrual cramp. Because of the brief duration of each individual sonication and through the use of sedative and analgesic medications to relieve the pain, patients are able to undergo the treatment. During each individual sonication, the treatment is observed via MRI. This not only allows us to see that the targeted area is being heated, but that enough energy is being delivered to achieve adequate heating to destroy the fibroid tissue at the focus. This is a critical advantage of MR guidance that allows for both safe treatment as well as verification of success during the treatment. By the time you get off the MR table, we will know how effective the treatment was in ablating your fibroid. After the treatment, diagnostic MRI images are obtained to evaluate for treatment effect. By looking at the fibroid after the injection of contrast, we can determine the treatment effect, specifically the percentage of the fibroid that is no longer perfused and has been ablated or destroyed. We would like to achieve 100% ablation, with numbers typically ranging from 70 to 90% in our cases. After treatment, you'll return to the recovery area, where once the sedation is worn off, you'll be able to go home in a few hours. It's a good idea to have someone available to drive you home. Typically, women are able to return to normal activities within 1 to 3 days after treatment. While the risk of adverse effects from this treatment are very low, you may experience some abdominal discomfort or soreness from lying on the patient table for several hours. In general, a mild analgesic is all that is needed to relieve this discomfort. In addition to the discomfort during treatment that we already discussed, risks of treatment include vaginal discharge or heavy menses, inflammation of the anterior abdominal wall muscles or the subcutaneous fat, skin burns, nerve stimulation or injury, damage to adjacent structures such as the bowel, and deep venous thrombosis. MR guidance is a critical component of minimizing these risks of treatment. Using MR imaging, we can visualize that the skin is in perfect contact with the gel and water bath that we've used to position you during your treatment. By avoiding any error in the beam path, we can minimize the risk of a skin burn. In addition, by visualizing the targeted tissue throughout the treatment, we can avoid the risk of having the beam path intersect with bowel, and thereby minimize the chances of any injury to the bowel. The benefits of MR-guided focused ultrasound treatment of uterine fibroids is that it's a non-invasive outpatient procedure that's performed under mild conscious sedation. Women are generally able to return to work within a few days after treatment, and there's no radiation exposure during the treatment. Although it takes weeks to months for the body to resorb the treated fibroid tissue and for the fibroid to shrink, bulk symptoms such as urinary frequency can improve within 2 to 4 weeks after treatment as the fibroid changes consistency and becomes softer. Menstrual bleeding can diminish within 1 to 2 cycles after treatment. Here at the Stanford Fibroid Center, we take a team approach to the care of patients with symptomatic uterine fibroids. MR-guided focused ultrasound is one of the treatment options that will be discussed with you during your visit at the Fibroid Center. In summary, by selecting patients who are appropriate candidates for this procedure, MR-guided focused ultrasound results in successful treatment of uterine fibroids with symptomatic relief and a rapid return to normal daily activities.